In this lecture, we are going to discuss different drugs that are used in the treatment of the hepatitis C. So without wasting time, let's get started. First of all, we will look at the structures of the hepatitis C virus. So first component that is present outside the virus is the envelope, and inside the envelope you will see the two proteins, glycoproteins, E1 and the E2 glycoproteins. Inside the envelope you will see the presence of the capsid that is made up of the protein, and inside the capsid there is a genomic material. In that case you will see the single stranded RNA, and the sense will be positive. Next, we will look at the different types of the proteins. So proteins can be structural, that makes the structures of the hepatitis C virus, and the protein can be non-structural, that don't make the structure, but they are involved in the functions in the hepatitis C virus. So before discussing these proteins, we have to clear this concept that from the DNA you will see the synthesis of the messenger RNA, and from the messenger RNA you will see synthesis of the proteins, or you can say enzymes. But in our case, this RNA is single stranded and it's positive strand. It directly translates into the proteins, or you can say enzymes. So our process will start from the messenger RNA, because positive strand acts just similar to the messenger RNA, and proteins they will form the structured proteins, and enzymes, they are actually non-structural. They performs the function, but they are not involved in the formation of the structures of the virus. So structured protein, first is the C for nucleocapsid, that make the capsid and enclose the genomic material. Next is the E1 and the E2. These are the glycoproteins. Glycoproteins that are present on the envelope of the hepatitis C virus. Next is the non-structured protein. First is the P7. This is the viroporin P7 that makes the ion channel in the virus. Second is the NS for non-structured protein. NS2, this is the cysteine protease. So before discussing cysteine protease, we have to again clear another concept, that protein forms as single in the form of polyproteins. After that, different enzyme cleaves these proteins and form the different types of the proteins. So all the proteins forms in single form, that is polyprotein, and after that enzymes cleave these polyproteins and make the different types of the proteins from single protein. Okay, so in that case NS2, that is the cysteine protease, cleave the polyprotein and convert or form the different types of the protein. Next is the NS3, this is the serine protease. This also do the same function, but a little bit different from the NS2 in a sense. They cleave the different sides, like cysteine protease cleave the different side, and the serine protease cleave the different sides of the polyprotein. But NS3 also involved in another function, that is helicase function. Okay. Next is the NS4A. This acts as a cofactor, and it involves, or it enhances the activity of the NS3. So NS3 is the main proteins, and NS4A helps or regulates the NS3. Next is the NS4B. This is the membrane altering protein that provides the replication sites. Next is the NS5A. This is the phosphoproteins that helps in the RNA replication in the hepatitis C virus. Okay, and last is the NS5B. This NS5B is a RNA polymerase, and RNA polymerase will ultimately synthesize the RNA in the hepatitis C virus. So this is the main targets of the drugs that we will discuss, that is the NS3, NS4A, NS5A and NS5B. So drugs that are related to that are the target of the NS3, NS4A is the, you will remember these drugs with the mnemonic BTSVPG. B for boceprevir, talaprevir, semiprevir, voxeloprevir, paritaprevir, grazoprevir, glecaprevir. So these are the different drugs that inhibit the NS3, NS4A. And you will see at the end of these drugs, you will see the previr word. So that is the important drugs related to the NS3, NS4A. Next is the NS5B inhibitors. So in this case, you will see the two categories, nucleoside analog and non-nucleoside analog. Nucleoside analog acts as a nucleotide in the hepatitis C virus. So that drug is sofosbuvir, and non-nucleotide is the daclatasvir. And in that case, you will see ending will be buvir. Next is the NS5A inhibitors, and again you will remember it with the mnemonic develop. D for daclatasvir, E for albasvir, V for velpatasvir. Again, E is the repeating word, and L for ledipasvir, O for ombitasvir, and P for pibrentasvir. So this is the mnemonic for the remembering of the NS5A inhibitors. And at the end of these drugs, you will see the svir word. So these is the different category of inhibitors: NS3, NS4A inhibitors, NS5B inhibitors, and NS5A inhibitors. Now we will look the different combination in the market or in the brand. You will see the different combinations of these inhibitors and make the one drug. So first is the Zipatrir. In this drug, you will see two drugs, NS3, NS4A inhibitors and NS5A inhibitors. So in that case, you will see the grazoprevir and the albasvir. Next is the Mavorite. In that case, you will see the two combinations of the drugs, glecaprevir and the pibrentasvir. Glecaprevir is NS3 inhibitors and the pibrentasvir is the NS5A inhibitors. Next is the Tecnivi, and in that case you will see the paritaprevir and ombitasvir. Along with that important thing, ritonavir is a booster of the paritaprevir. Okay, next is the Vicara Pack and the Vicara XR. In that case, you will see the different combination, paritaprevir, ombitasvir. This will be the same as the previous one. Ritonavir, this will also be the same. And daclatasvir is an additional drugs that added in this Vicara Pack. Next is the Sovaldi-Declinza. Sovaldi, in that case, you will see the Sofosbuvir and daclatasvir. Sofosbuvir is NS5B inhibitors in that case, and daclatasvir is the NS5A inhibitors. So brand name of Sofosbuvir is the Sovaldi and the daclatasvir is the Declinza. Next, Havonai, that is the drug. This is the combination of the Sofosbuvir and ledipasvir. Next is the Epclusa, that is the combinations of the Sofosbuvir and the velpatasvir. And next is the Vosavi, and in that case you will see the combination of three drugs, that is Sofosbuvir, velpatasvir, and the voxeloprevir. So these are the different combinations of the drugs that are actually present in the market. So these are the different drugs that are used in the treatment of the hepatitis C virus. So if you still have any question regarding any of these drugs, you may ask in the comment section. Thank you so much.